The Dentalpreneur Podcast. Okay, doctor, it's time to put down that handpiece. You're listening to the show dedicated to helping dentists get their lives back. It's time to decrease your stress, increase your profitability, and regain your passion. Now introducing your host, Dr. Mark Costas.
Hello, everyone. Welcome to another episode of the Dentalpreneur Podcast. I'm your host, Dr. Mark Costas. What's up, my friends? I hope you're doing great out there today. Hey, I'm really excited because I get to spend my morning with an old friend. She's not old, but we've been friends for a long time. Her name is Rachel Wall. I'm sure you guys have heard of her. She's an RDH and CEO and founder of Inspired Hygiene, a coaching firm with a 20-year proven process to help teams elevate hygiene services, systems, and profits. Inspired Hygiene strives to help dental teams achieve a triple win with healthier patients, empowered, engaged hygienists, and a profitable practice. She's an award-winning educator and author of the book, Return on Hygiene, and has spent over 30 years serving the industry as a clinical hygienist and hygiene productivity coach. Rachel, welcome to the podcast. How are you?
Thank you. I'm doing great, Mark. Thanks for having me.
It's good to see your face. And gosh, we had some really interesting things to talk about in the pre-chat. Congratulations. Do you have a graduate or do you have a senior?
I have a rising senior.
A rising senior.
I have a rising senior. So yeah, we're starting the college exploration part of life. Yeah.
That's really exciting. Is it your first?
Yeah, it is. Yeah, this is my first senior yet. My son is a rising freshman in high school, so That's kind of where we are right now. But they're a blast. They're doing well, and just excited to see kind of what's coming next for them.
So you are 4 years from empty nest. I'm 3 years from empty nest. I have a rising sophomore. I have my second one just graduated 2 months ago. So it's an exciting time, and the whole college selection process is super fun. You get to take some trips around.
Yeah.
But yeah, best of luck to you. I'm sure
Thank
that's going to be, it's going to be a really exciting adventure.
Yeah, it will be fun. I've heard that I want to be there for all the senior year things. So, kind of looking ahead on my calendar and trying to prepare and make sure I'm not at a dental conference on the day of graduation,
I know.
It's
really hard because for us, sports schedules, particularly like a club sports schedules, come out a month before the season starts, and I'm booked out through 25 already. So
exactly,
you have to kind of be nimble and figure out how to get around things like that, because I don't want to miss a thing with my kids, but you just don't get enough advance notice with sports and even school activities a lot of times.
Yeah, that's for sure true. Yeah, my son's in club soccer. So yes, that is for sure the case. But, fortunately, I've got, my husband, my partner, and we just kind of make it work. And, but I'm noticing that, Mark. And as my kids have gotten older, I've gotten way more selective about travel and things because, saying yes to something means you're saying no to something else.
For sure.
And you just kind of have to figure out what that is. But it always seems to work out, and we get it going. And you've got a team, I've got a team, and sometimes we step in for each other. So it's good to have that backup.
Absolutely true. Yeah, I have my second son. My youngest son is a club soccer player. My oldest son was a club soccer player. He played on a national level team. So it was hotel rooms every single weekend. He practiced 3 times a week in Scottsdale, which is a 2-hour drive from us. So we did the club soccer thing to the nth degree. And the ultimate goal, of course, was to get a soccer scholarship, which he was able to, he accomplished, but then declined 2 soccer scholarships to go to San Diego State to be a full-time student. And I wish he would have told us that 5 years earlier, but you can't take away all the memories. It was incredible. But we spent 7 straight Thanksgivings in a hotel room because of club soccer.
So I have heard these stories over and over. And so we've decided not to go that route. So we're doing club soccer, but we're not doing the ultra competitive club soccer. We're kind of like taking it, we're in moderation mode. So yeah, there's a lot to be said for that.
I applaud you 100% for that, because I mean, you get sucked into it. It's like, oh my gosh, they have to try out for this team, and they make the team, and it's like, oh, you're so lucky that he made that team. And it's like, yeah, but that means 70 games this year.
Yeah.
That means his league was in 5 different states.
Oh
So,
my God.
so we were in Irvine one weekend, and then Vegas the next, and then back to Scottsdale, and then Denver. And those were league games, which is, I mean, it's absurd. So now you're talking about like who has the means to do that, right? Who has the time and who has the means. So you're like really skewing the competitive pool towards people that like can afford to fly their kid to 5 different states every month. You know, it's
Right.
I don't know, it's crazy.
Yeah. Yeah. It has gotten a little out of hand, I will say.
It really
For
has.
sure.
So back to hygiene. I'd love to talk about the history of your company. So you got your RDH 20 years ago?
No, 1991.
Oh,
So yeah, a long time ago.
okay.
I started Inspired Hygiene in 2004. So
Okay,
it's
that's
20
where
years
the
of
that's where
Inspired
the 20
Hygiene.
came
Yep.
from. Yep. Uh-huh.
Yep.
Awesome.
Yep. So 20 years of Inspired Hygiene this year, which is really awesome. And just, just looking back over
Congratulations.
that. And it was just me for a long time. Now I'm really fortunate to have a great team, and we've grown a ton. It was just me. Started the business, moved from Raleigh, North Carolina to Charlotte. And I had asked one of the reps in Raleigh, because I had worked for some fantastic dentists in that triangle area.
Mhm.
And I said, who are the best dentists in Charlotte? And so she gave me a few names, and one of the names on the list was Dr. Chris Bowman.
I just saw Chris this
And
weekend. It's so
yeah.
great to see him.
Yeah. And so I kind of just walked into his practice with my resume, cold, like, hey, are you looking for a hygienist? I'm looking for 2 days a week. And crazy enough, a gal that I had gone to hygiene school was a hygienist there at the time, and she was sitting at the, reception area. And so that was just kind of it. And then so I worked with Chris for 9 years while I started building Inspired Hygiene. And then we kind of knew at the moment he needed, more hygiene days than I could provide, and my business needed more from me. And so we're still great friends. He's still my dentist, my family's dentist. I have filled in some over the years for him. Sometimes I'll get in there and I'm like, I just would like to sit in the chair and just see a couple people. It might be my family members, but
Yeah.
he's a great friend of mine and a great mentor, and he was always super supportive. So that was a big part of growing Inspired Hygiene over the last 20 years.
That's amazing. That's amazing.
Yeah.
So what's the business model, and what are the philosophies of Inspired Hygiene?
Yeah. So our business model is still really kind of the classic coaching model that, dental consultants started out with regards to a mix of in-office,
Okay.
even chairside coaching, where we're really helping the hygienists get calibrated with how they're identifying periodontal disease, how they are utilizing technology, how they are kind of pre-diagnosing even restorative for doctors.
Mhm.
So getting the hygienists and the doctors calibrated on all of that, coupled with virtual support, so that we can help them kind of stay on track and implement what they've learned. We have a pretty good, solid framework, I think. We've gotten consistent results over 20 years with our framework for coaching.
Mhm.
Part of it is, doing a deep dive analysis into the hygiene department and seeing where the strengths and the opportunities are. The other part of it is we have the team go through some pre-education before the coach just shows up. So they're not showing up cold, in the practice. They're building relationship. They're also, the team is able to kind of get a sense of our philosophy and what we are going to be encouraging them to do through this pre-education, so that when the coach gets there, it's not the first time they've heard these concepts, and they're ready to hit the ground running. And they've also had time to process, how is this going to look different? What do I need to change in my hygiene workflow? What's coming up for me, like, mentally? How am I going to kind of, approach my patients with this? They have the time to start to process, a different way of approaching periodontal diagnosis, doctor handoffs, All of those different ways that the hygienists work within the practice. And I think that's a real key to the success, because then when the coach is there, they can just really work on building those relationships and then helping them figure out how to implement those things and helping them work through the inevitable obstacles that come up when you're implementing new services or a new way of, treating patients.
For sure. Changing mindset in humans is difficult.
Yeah, it really is. And so our philosophies are all based on the American Academy of Periodontology standards and recommendations. We look to their papers to provide, backup for what we're recommending. I'm a super huge nerd. So those of you that are watching the video, you can see I'm holding up a giant, 10-pound textbook.
It is huge.
That is the, latest version of clinical periodontology and implantology. It's like, okay, can we back up what we're recommending with regards to how hygienists are detecting disease and what we're recommending? Our philosophies are not, and I don't think there's a problem with this, but we get a lot of questions about does your protocol match up with ours? So sometimes results are driven heavily through product sales. I think we all remember kind of the early soft tissue management. There was a huge product component to it, but it was also, kind of created a lot of awareness in dentistry that we need to address this, lack of diagnosis of disease. But ours is more based on services that are clinical services. And then, yes, there are adjuncts as well that we recommend. But if a practice says, hey, we believe in lasers versus this other tool, then we want to follow them there and help them implement that to the best of their abilities. So we have, clinical philosophies around all of the adjuncts that support the best outcome with regards to hygiene procedures and hygiene care. But it has to fit the doctor and the practice's, core beliefs and philosophies as well.
Yeah, I love that. Now, obviously, you've grown and you have a really rather nice footprint. You get the luxury of being able to work with the clients that you want to work with, that share your philosophies, et cetera. They're attracted to you because they share your philosophies. But us as dental practice owners, how can we become better coaches and open up those lines of communication without getting, that deer in the headlights kind of, that's not how I learned it in dental school, and I'm going to do it my way kind of reaction?
Well, I think in response to that is, we hope that we're not practicing the way that we did. I graduated in 1991. I hope I'm not practicing clinically or following the same philosophies that was there 30 years ago. Now, obviously, there are some tried and true things, but I think just being transparent and authentic as the clinical leader to say, okay, I understand that, and here was my experience when I came out of dental school, and here's how different my clinical practice is now than it was when I graduated 10 years ago or 15 years or 5 years ago, whatever it is, right? And the way that I've been able to evolve that is continually challenging myself to be aware of what's in the industry, what's available, because the last 10 years, even the last 5 years, the amount of technology and products and different services that are available to improve our patients' outcome has increased exponentially in my observation.
For sure.
So
Agreed.
Being aware of what's out there, being willing to take a chance on something in order to come out with a better outcome for the patient, and really showing some specific examples of that in the practice. So, just remembering as a dentist, you are the clinical leader. And that is a very, very important role, and your team will follow you. The team's not willing to go any further than the dentist, the leader, is willing to go, right? So I would say that's one step. I think the other step is being willing to develop, and we have a guide for this that anybody's welcome to get off of our website. It's called our Standard of Care Worksheet. So just being willing to develop a clear written standard of care for your practice, particularly for hygiene, which is what we're discussing now, but it can be applied to everything. It's kind of like the playbook, like things that you all teach, is really having that written and developing it in a collaborative way with your team. So not writing it in your office and then saying, okay, this is the way we're going to treat our patients, but rather, okay, I'm noticing a lot of inconsistencies and I feel like there's things that we could provide our patients, and I want us all to be on the same page. So let's pick this one area, let's talk about it, and then let's create this clear standard of care. Does everybody agree with this? Where do we need to tweak it? So having a collaborative approach and creating that clear standard of care. And then I think the other thing is being willing to have frequent conversations about it. So not waiting until the annual review, which really never happens, right? And having those micro conversations with the team when they're really doing well and they're stepping out of their comfort zone, like acknowledge that. Or when they're not following the standard of care, being willing to say, hey, I noticed this week there were like 2 or 3 patients that I would have treatment planned them for periodontal therapy, but you were moving them, checking them in 6 months. Like, can we talk about that? How are you feeling about this? What do we need to kind of, recommit to or discuss?
Yeah. Okay. I like that. So, not a lot of discussion about production then. It's all about the appropriate care for the patient that's in the chair at the moment.
Our approach is to focus on that first. And with intentional action, the production will come.
Okay.
It's not a, don't worry about it, it'll come kind of thing, right? But if we are taking action on what we agree to do, which is our standards of care. So for hygiene, if we're agreeing that when we see this, then we're going to recommend this service because it's in the patient's best interest, then that will create a more well-rounded, elevated hygiene service mix. So it won't just be prophy focused. And those things are going to create increased production. And we also want to, by the way, like set up the schedule so that it supports that, right? Because if you're recommending things, but there's nowhere to get it on the schedule, you're not going to increase production and the patient's not going to get the care. Yeah. So we go in with that approach first, and then we show the team, look at the progress you've made. Like in this area, you've gone from this baseline peri percentage to this, and look at your daily hygiene production. It's gone from this to this. So we do talk about it, but it's not our lead in.
Got it. Awesome. Okay. As a leader in the coaching ranks, but also specifically in hygiene, I was wondering your take on, there's a significant number or percentage of hygienists and dental care auxiliaries in general that left dentistry during COVID and never came back. That did skew the kind of the demand curve for hygiene significantly, right? So supply and demand has been off since COVID, and I think everybody's very aware of it.
Yes.
With that has come a significant rise in the expectations for wages for even brand new hygienists. And it appears to me, and this is anecdotal, this is just what I see amongst the dentists that I talk to and the dental offices that I have the privilege of coaching, that there appears to be like this shift towards kind of an adversarial relationship between hygienists and doctors. Have you noticed that? And what do you think we should do about that as a profession?
Oh yeah, I have noticed it. But I will say it's not, it is there. But I've also noticed a lot of practices that the dentists and hygienists have a great relationship. So I think that if there was, COVID just revealed so many things, and we don't even want to go back to all of that. But if there was a strained relationship there, it just amplified all those things, right?
Indeed. Yep.
But I don't want to say that it's a symptom of a problem that was there before, because there's certainly in DSI and a DSN, dentists who are really striving to have great relationships with their hygienists, and they're met with a less than positive response. So I don't want to completely blame it on the leadership aspect of it. I think it's personal leadership from all parties, right? As how this is being approached. So yes, people left the profession. Also, those that came back, a lot of the hygienists cut back on the number of days that they were working.
Mm-hmm.
And if they can make more, then they can afford to do that, right?
Mm-hmm. Mm-hmm.
So now we're met with, how do we make sense of and how do we maintain this profitability point that both your coaching organization and mine sets out as a benchmark, right? The 3-to-1 or the 3.3-to-1,
Mm-hmm.
which is production to compensation.
Mm-hmm.
How do we reconcile that with insurance reimbursements that are going down and hygiene wages that are going up?
Yep.
Right. And the practice owner is kind of stuck between those two things.
Mm-hmm.
So one way that many of the clients that I've observed, in DSN is that they're changing their relationship with the insurance companies. That's one way. So that they're not beholden to some of those low reimbursing, plans.
Mm-hmm.
The other way is getting creative with hygiene compensation. I know that that's a touchy subject too, but also giving the hygienist, some ownership over, okay, if this is your desired wage, we can work this out, but we have to work together.
Mm-hmm.
We have to work together. And, you may just say, at this point, I'm not able to give a blanket $60 an hour compensation if we're not in this together and we're not working for this to be a win for the practice, for you, hygienists, and for the patients.
Mm-hmm.
So I think that, I know and I see that more and more dentists are looking at alternative ways rather than an hourly wage.
Mm-hmm.
And there is no compensation model, in my experience, that doesn't have loopholes or things that, get like, I didn't think about that. And now you're deep into this, like, kind of scenario of, feeling like there was some piece of the compensation model that we didn't think about that now is becoming an advantage to the other party. You know what I'm saying?
Yeah, for sure.
And it can get super complex, and we don't want it to be super complex. But in my opinion, that is one way to address this, is for the hygienist to have some ownership in their compensation as well. I was at a conference recently, and I heard a dentist say, he's like, they quit calling it a bonus and they call it a compensation modifier or an income modifier. Mm. And I love that approach, because then it's like that team member, they're responsible for modifying their income, right? Whereas sometimes when they don't get a bonus, it somehow becomes the owner's fault. Mm-hmm. Or if you move the needle on the bonus, then it's, you're the bad guy kind of thing. Mm-hmm. So I can kind of see it from both. I own a business. I've never owned a dental practice, but I've been a hygienist. So I can kind of see it from both ways. So I don't know if I answered your question, but that's kind of some of my observations. So what to do about it? I think we have to talk about it. We have to talk about it in order to heal it. Mm-hmm. And I think that there are some dentists out there that have some hygienists that are refusing to follow science-backed treatment standards, and that's not okay.
Yeah.
And so many of those dentists are afraid to make a change because there aren't a plentiful number of hygienists out there. And I understand that, because it is a real problem. But the thing is if you're allowing that in your practice, there's never going to be room for somebody else to come in that aligns with your philosophies and is a really great diagnostic partner, because those hygienists are out there too.
I agree. They are. They seem to be unicorns and fewer and farther between, but I do still have optimism that this, yes, the pendulum's going to swing in the other direction, and we're going to kind of find a happy median between where that,
yes,
in comparison to the way that things are right now. I mean, I've been doing this
yes,
for I graduated in 2002. So I've been doing this for 22 years now, and I've seen it both ways. I've seen where it was much in favor of the practice owner, and then now you can't get further from the way that it's been in the past to the pendulum swinging in favor of the hygienist right now. But what I don't like to see is people in leadership positions that are stoking the fire and continuing to agitate the relationship between, hygiene, hygienists and
100%.
doctors. And I hear it a lot. And again, it's anecdotal, but hey, you know, I had this instructor say, you know, never settle for this and don't take it. It's just an unhealthy narrative that a lot of people are perpetuating. And I think it's not good for the profession in general.
100% agree. And I really feel like our role is to help heal that divide. I don't know right now exactly how to do that, except that we're doing it one client at a time.
Mm-hmm.
And now, you know, there are going to be hygienists that in our client offices, the vast majority are like, oh my gosh, like I was nervous about this, you know, experience with Inspired Hygiene, but it was amazing. And I feel renewed and I have a voice and, you know, we were really able to collaborate and it was a really good thing. And then there are going to be a few that are not willing to look at the science and not willing to elevate their level of care. And then they will leave and go to find a practice that's on that level.
Yeah.
So no, I agree with you because I, you know, the instructors, if that's what's happening, and I have heard that more than one time. And I know, again, that's not every instructor, but there are times that they're like, you know, don't settle for X, is they don't know the whole package, right? They're not looking at the whole big picture of what's being offered or what the opportunity is in that particular practice for this hygienist. It could be that they're starting at a lower rate, but they have, you know, some incredible, you know, healthcare package, or they have the opportunity to move up, you know, in this practice to be a leader. And, you know, there's just a lot of things that go into that they probably don't know all the details about.
Yeah. Yeah. And
it is very unfortunate.
It happens in dental education as well. It's like a lot of times people, I don't want to say hide, but a lot of people end up in teaching positions because they prefer that to the clinical world, or sometimes they weren't great in like a high pressure clinical environment. So they retreat to education. And again, I'm not trying to generalize, but at times this happens. They retreat to education, and they don't really have a fair basis on the different types of scenarios that can take place in the real world. Yeah. In the trenches.
The real life scenarios. Yeah. So I do think things will reset to a certain point. They won't go back to the wages, right? Pre-COVID per se. But, you know, I'm even observing in forums that, you know, the dentists are saying, you know, if there's somebody that's asking for an hourly rate on a staffing app that is way out of the range, that I'm just not even approaching them. So, you know, that will probably happen more and more. And, you know, the upside of, you know, there are a lot of more staffing apps and things like that out there. So now there's legal ways to do working interviews and to get introduced to, you know, hygienists in your practice that you want to work with. There's going to be a certain number of hygienists that stay in that kind of freelance model just because of flexibility, and maybe they have some, you know, they're in a point in their life that they want to have that and they want to travel and do different things and not, you know, be committed to one practice. But I also feel like after a number of years, you know, temping in multiple practices every week or every month, that gets old. I mean, I've done that. And I've been long-term temp in practices too. And, you know, that gets tough. And I think there will be more hygienists that are looking to find a home, you know, that really fits.
Yeah. Yeah. I appreciate your optimism. I share your optimism as well.
We have to. I mean, we can't go the other direction.
No, we can't.
You know, and the other thing is just continuing to encourage, you know, folks in, because the dental hygiene career is a great one. I mean, you know, proof of what we just said, it offers flexibility. You know, it's an opportunity to really connect with people and to serve. And so I see, you know, the practice leaders and hygienists having these hygiene departments going down one of two paths. One is loss leader, right? Okay, so we're paying our hygienists this great wage. We're still accepting these low paying plans. And so we're just looking at it as a way to get patients in the door, a necessary evil. And that is only going to kind of push hygiene more into the Profi Mill standard.
Yep.
The other way is looking at, you know, how can we create a center for health that's going to leave a legacy instead of being a loss leader, and really embracing all this, opportunity for service that we have now. I mean, look at things like, I could just list them all, like, utilizing our ultrasonics, utilizing GBT, utilizing PeriProtect, utilizing Curodont, utilizing lasers, getting hygienists more involved with wellness scans and bringing up, just even from an educational standpoint, aside even from, looking at like clear aligner therapy. And there's so many different ways that we can elevate this profession and make it interesting. I mean, we have, I'm sure a lot of your doctors that are in your program, right? They have team members that are going to become, have their phlebotomy license so they can draw blood for a platelet-rich fibrin and all these different things that were not even on the table 10 years ago.
Yeah. Yeah. It's
so
true.
There's a lot of opportunity to elevate the care, the experience for the hygienist, and the profitability of the hygiene department as well.
Yeah. I love that. Okay. So we got about 10 more minutes here, Rachel, and I would love to kind of dig into some specific stuff. When it comes to coaching, you and I know I've been in the trenches. I've traveled for a good part of my consulting career. I would travel to every single one of my members' offices and work with their team. And nothing is more disheartening than when you walk in and there's a bunch of people sitting around a table with angry looks on their face, with with crossed arms, like very suspicious. Very cynical about the last guy that came in and disrupted everything, and 2 people ended up getting fired or whatever preconceived notions they have in their head about what a consultant is. But what are some of the common themes that you're seeing for the experiences that you're having in dental offices, or your coaches are reporting back to you right now regarding any kind of resistance that you may be experiencing when it comes to the coaching model or that sort of thing?
Mm-hmm. So I would say, for sure, for 20 years, my entire career in coaching, there have been team members that are resistant. Mm-hmm. There are team members that are super open, right, and ready, like, yes, we need help. And it's the doctor needs help. And sometimes that's true. We're glad you're here. Some have had fantastic experience with consultants in the past. Mm-hmm. And some are just nervous and reluctant. And I will say this too. I think this just goes, I think it's just something I have to remind myself of is, we work with amazing, practices and teams, as do you at DSI and DSN. Mm-hmm. And we come to think of them as like the typical dental practice, typical dentist, but they're not.
That's true.
Right? They are the top 10 to 20% of dental practices. So if you're listening to this and you want to be, the top 10 to 20% are the ones that are in these coaching programs. And the reason they're there is because they're in these coaching programs. Mm-hmm. So, if you want to elevate your practice, that's a great way, because you're not only learning from the mentors, but you're also learning from others, they're in that position. Mm-hmm. But even those, so when there's great culture, there's great communication, then the incidence of resistant team members is less, right? Mm-hmm. Because they've seen their doctors step out of their comfort zone. They've seen their doctors be coached. They've seen their doctors willing to, use a new material, and maybe they have to do a redo because it didn't work the first time, or things like that. They've seen their doctors do things like that. And their doctors are sophisticated and, I think, aware enough personally to know that they have to establish a culture of never-ending improvement and continual education.
Yes.
So when that is part of the core values, and it is understood and it is demonstrated by the leader, and that they have frequent points to experience that, right? So they're frequently bringing in like new technology and things like that, and they just know, like, okay, this is just the next level up for us. Mm-hmm. And it's going to be fun. It's going to be a little scary, but it might be exciting. We're going to learn something new. That's the best, right?
Yes.
The next is, even with those, and I'm sure it's true for any team member, if you're bringing in someone to teach somebody billing and they've been doing billing for 20 years, it's like, well, what are you going to teach me that's new about billing?
Yeah.
Right. And so it happens with hygiene, right? It's like, okay, what are they going to teach us new? Why do we need this? And so the next level is, so you have somebody that's super open, and then you have someone that is reluctant. They're reluctant, they're nervous, they're hesitant, and that is very normal and very common. And so I would say to the practice owners, if you're observing that, a lot of times, and you're wanting to bring in, a consultant or just even implement something new in your practice on your own, is a lot of times it's just because they need more information. So they need more information. And is this experience going to line up with my beliefs and values? Is it going to line up with our core values as a practice, whether those are stated or understood core values? Are our patients going to accept what they're going to ask me to do? Is the leader on board? Is the leader going to back me up, or are they just going to be like, here, you do this and I'm out of it, right? And then the team often knows what the obstacles are going to be with implementing something new, sometimes even before the leader knows. So they might know, okay, I tried that 2 years ago, and this is the response I got from 2 patients, and I don't ever want to experience that kind of rejection or, attitude again. And a lot of times the team that's reluctant, and I would say this applies to anyone across the board, is they know what the obstacles might be, but they don't know how or if it even can be fixed, or they might not have the authority to fix it.
Right.
So it might be, well, that's great, but there's nowhere to even put these patients on the schedule. So why would we diagnose more when we can't even get them in? Or that's great, except that I'm working with instruments that I brought from hygiene school. And I'm afraid to ask for anything else because we were told that we don't have it in the budget. And so, so there are obstacles that they don't know that can be fixed, and they don't have the authority to fix.
Yeah.
But those folks that are reluctant, if you can reassure them on some of those points, then they'll be open. And if you can build trust that you're going to listen to what their concerns are, then they'll be open.
Yeah.
The next level is the resistance.
Okay.
And this is something that we've seen for 20 years. It happens. It's not common, but it does occasionally happen. I would say in 10 to less than 20% of the cases, if we're looking at all the hygienists that we've worked with over the years, is those that are shown the science, they're given the framework, they're given the verbal skills, they're given an opportunity to practice the verbal skills, they're given an opportunity to give input on the standard of care, and they just flat out refuse to do it. And they're given an opportunity to explain why they don't believe in this, in it, and either they'll communicate that or they won't. And then that's when, there's a problem, because, the doctor and the hygienist actually have a responsibility, right, to the patients and to their community to perform their duties at a certain level. And if there's a level that is established from, the AAP and just science in general, and the hygienists are not willing to diagnose disease, not willing to step out of that prophy comfort zone, then, there may not be a fit between that doctor's treatment philosophy and core philosophies of the practice and the hygienist.
So what is your advice to somebody, especially in a market where it is so difficult to get a warm body? And you're looking at maybe being able to fill a position with a temp, and sometimes not even temps are available in certain markets.
Yeah.
So what if you have this resistant type of person? They're not maybe a toxic culture type of person, but they're just happily doing what they're doing. And it's not according to your philosophies and your coaching. Like, what would you suggest in a situation like that? That's a hard question, I know.
Yeah, it is. But I'm glad that you brought up, they're not, because if they're toxic, then you're going to
you're better off without them.
Yeah. You got to let them go.
Yeah.
But if they're not, and they're just, there are some people that have a lot of long-term relationships with patients, and they're just they're not confident.
Mm-hmm.
So I would say just keep nurturing the attitude of continual improvement.
Mm-hmm.
Even if you see little improvements in progress, praise that.
Mm-hmm.
I would say use specific patient examples. So for example, if they're reluctant to really be proactive and progressive with, let's say, kind of pre-diagnosing restorative or educating the patient, right? Looking for things and seeing like, okay, this is a big amalgam. I'm going to take a picture and kind of let the patient know. Like using examples of patients like, hey, so Ms. Jones came in the other day and remember that big amalgam? Well, it broke and now we're going to have to remove the tooth.
Mm-hmm.
And not in a scoldy, like you should have done something way, but like, hey, I know we really care about Ms. Jones. And here's how I think that we could have approached that differently that might have prevented her from going through that. Like maybe we could have been more proactive and have a crown. You know, the hygienist might come back and say, well, doctor, that's your responsibility. But, you know, how does it benefit the patient? I'd say focus on that first if that's where they're coming from. Because a lot of times that's they're looking at that. And how does it benefit the hygienist, right? So what I always tell hygienists too is, look, if we're teeing up treatment for the doctor, so think about me working with Dr. Bowman, right? I knew I had to have the photos, I had to have everything teed up, and I actually really enjoyed that piece of it. And he could come in and his exam would be in and out.
Mm-hmm.
Like, yep, I agreed with that. That's what I would recommend, and that's the next section to start. So Rachel's going to answer all the questions that you have, and if he knows he can get in and out quicker, then I know he's going to come in for an exam quicker.
Yeah.
So again, it's that win-win-win. It's like, how do we start to kind of plant some seeds, maybe with that person that's resistant, of how could it have gone differently, and how could that have created a win for all parties?
That was such a great, thorough answer. It's a great place to stop. Thank you so much, Rachel. Wow.
Pleasure.
All of those years in the field, but also as, a clinical RDH has really, really led to a bank of knowledge that's just so valuable. So I really appreciate you sharing. How can people go ahead.
Thank you. And I just want to give credit to our team too, because all of our coaches are hygienists and they're all very experienced. And
how many do you have right now?
We have 5 coaches. Yep. And all kind of spread out across the country.
Mm-hmm.
And they're, we just kind of all put our heads together, and it's a really cool kind of think tank. And we love sharing that with others.
That's awesome. So what's the best way for people to get in touch with you?
Yeah, just go check out our website, inspiredhygiene.com. There is a book a discovery meeting link there.
Mm-hmm.
Would love to do that. We love having, folks just send us a little bit of hygiene data so we can really dig in and have a specific conversation with them about how we might be able to help. And then there's also a resource guide tab on our website that has a ton of free resources there. You can find that standard of care worksheet there, and just a lot of great things to help folks out. So thank you so much for having me.
Awesome. Well, thank you so much. I hope you guys have an awesome summer there. I'm going to be at the Outer Banks. I'm going to be in North Carolina twice in a month. So I'm really excited. I'm going to be traveling out there to celebrate a good friend's anniversary. So I just love your state, and I'm glad to be on that side of the country. Yeah. So have an awesome summer, Rachel. Thank you for your time.
Mark.
All right, ladies and gentlemen, Rachel Wall.